Hello and welcome back to Arunachal Mirror. I'm GT Tagam. So today on Arunachal Mirror, I have with me three doctors who will be discussing about the symptoms of second wave of COVID-19 and the precautionary measures one need to take in order to stop the infection from this contagious virus. And also, we will additionally discuss on the safety of doctors and healthcare workers during COVID duty. So today I have with me on the panel Dr. Lobsang, who is an eye specialist at RKMH Hospital and is also the president of Indian Medical Association of Arunachal chapter. And next we have Dr. Taying Kumar, who is a chest physician and a consultant at DCH Chimpu. And next we have Dr. Mingam Pertin, who is a nodal officer at TRIHMS. So I will divide this session into three, and everybody will be talking about 5 minutes each, very briefly. And in case of any questions, dear viewers, you can ask the questions. So we will take the questions, the most relevant questions only we will pick it up. So first, before we go with the discussion, initially I want to ask personally, Dr. Lobsang, last time when we, when the normal thing was starting, there was a tagline that ki COVID ke saath jeena hai. So what happened to that tagline, and what is the second wave of COVID? So before we go technically to the symptoms and precautions, Dr. Lobsang.
See, based on our past experience, so this pandemic would come in waves. It was expected only. So when the first wave hit us, so at that time everybody was taken aback because nobody knew how to react because situation was totally new. Hence, then I think according to the situation, our government also proactively reacted, and somehow we could contain the virus, spread of the virus. But then the situation was such at that time that our healthcare system, our own doctors, they were not prepared for such a pandemic. But now we have our experiences of the first wave, and since then, I think it was obvious that we have to live with this virus because based on our, I think, experiences from the Western world, already they had already undergone second, third lockdown owing to the second or third wave. So that's why I think we should also have been prepared for the second wave. But I guess maybe our whole pan-India people took it bit in a complacent way. I think elections happened and many religious gatherings happened. So I think that were the reasons why we are in such a situation now. I think still, I think being say in a small state like Arunachal Pradesh, we still believe that we can contain this virus easily because we have a smaller population to look after, and also our population density is very less. And I think if now that we have one more aid with us, that is vaccine is available. So if we can vaccinate as much as possible of our population, I think we'll be pretty much safe.
Okay, sir. Thank you. So next I will move to Dr. Taying. So Dr. Taying, so I want to talk about with you the symptoms of second wave of COVID-19. Are the symptoms same as the first wave, or is it different from the first one? Dr. Taying.
Okay, thank you. The symptoms in this second wave is almost the same as the first wave. Here also we see patients suffering from fever, all the rhinitis, all those things, and cough. Associated with newer symptoms that has developed this time will be a tremendous amount of ophthalmia or myalgia that's happening.
Yes.
Then we have got sudden development of diarrhea and all. And early progression to breathlessness is what we are seeing in this second wave.
Okay.
But here we see dyspnea more common in the general mass. So this second wave is more, it is rapidly progressing, and it is symptomatically, it is little bit harsher than the previous waves.
Okay. So there is an additional question regarding the test. Sir, आजकल ये जो जोर बुखार जो बोलते हैं, फीवर जो है, वो बीमार सुनाई नहीं देता है. The moment you have fever, then you are tested positive. So is there any difference between this?
Okay, the symptoms आपको कौन सा जोर बुखार जो बोल रहा है उसी के लिए ये देखिए fever is there. Fever has to be there in its COVID because through fever only we can see all those development of the progression of the disease into moderate category or a severe category associated with all these characteristics.
Okay.
So we generally see fever, and fever is, I think, compulsorily present in all the patients.
Okay. So, sir, how do you decide that the patient is COVID positive? On the basis of what?
The patient is COVID positive. We decide it on the basis of the investigations that are available in the market right now. One is the rapid antigen test. If it's positive, we confirm it. We deem it to be confirmed positive.
Okay.
In cases of negative RAT reports, we can subject the patient to RT-PCR or TrueNet, whatever is available nearby. So here, the next procedure, the next method is the RT-PCR.
Okay.
RT-PCR positivity confirmed, and after that we have TrueNet positivity also confirmed. But there are people, there are patients where we get all these reports negative, but with the symptom that amounts to cough, excessive cough with dyspnea and all,
Okay.
in which we can give the patient to radiological parameters like CT scan.
Okay.
So here CT scan, we go through the CT severity index and the CT scores. So as per that, in spite of negative COVID reports, we suggest a positive COVID on the basis of the CT findings.
Okay. Okay. So now let me move to Dr. Lobsang. So Dr. Lobsang, what are the precautionary measures one need to adopt?
So I think we have discussed enough on the precautionary measures. Still, I will insist on again. First and foremost is our COVID appropriate behavior. So mask is very important. Anywhere if you go, a double cloth mask or a 3-ply surgical mask or N95 mask, whichever is available. So that definitely gives you protection from the virus. And then your hand sanitization, like wherever you touch, at least you should sanitize your hands, and social distancing.
Yes.
And also like respiratory etiquettes. So while you are in public in front of any other person, while coughing, you should always close your mouth and then cough, and you shouldn't be spitting anywhere, because those droplets will carry the virus, and that can transmit to other individuals also. So I think these all precautions, if we take properly, I guess we can reduce the transmission of the virus to the maximum. But then, as I said, first and foremost is how, as a society, we react. So these things are already in place. Only thing is that it has to be implemented properly, and each and every individual must take it as their responsibility towards the society, that they take all these appropriate measures to protect themselves and also to others, and also the society as a whole.
Sir, apart from these 3 things like wearing mask, sanitizing your hand and maintaining social distance, अगर ये हम पहले से ही कर रहे हैं, but why did this virus start again? इससे ऊपर भी कुछ करना है क्या? Like any extra behavior that we have to adopt?
नहीं, अभी जैसे देखिए, apart from this, we have another most potent tool now, that is vaccination. तो vaccination के लिए अभी 45 plus का चल रहा है, and if when the state government will procure additional vaccines, it will be open for 18 plus population also. So through this, I think your channel, I would like to appeal to all the masses, our public, that everybody should come forward and get this vaccine, because though this vaccine may not be a disease preventing measure, but then this is a disease modifying vaccine, because after getting the 2 jabs also, you may have the infection, but at least you won't go to that severe or extreme condition where you need hospitalization or even ICUs. So I think vaccine will definitely prevent you. And I appeal through your channel that whenever I think above 18 population people get chance for vaccination, everybody should come forward and get
Okay.
vaccine.
So regarding the vaccination, there are some questions from the viewers. We will take it in the last part. So now so before we move to Dr. Pertin,
Sure.
so viewers, if you have any relevant questions, please do ask. I think we cannot, yes. So Dr. Pertin, I want to know from you regarding the safety of doctors and healthcare workers, the frontline workers on COVID duty, because there were some instances in recent past, where doctors have been subjugated to, also there were some physical, So what do you have to say on this? And is there any proper, measures from the government?
Yeah, when we before talking about the safety of the health workers and the doctors, I would rather like to tell you about the difficulties faced by the health workers and we as the doctors in the hospitals. As per the past experience, last year, when the first wave was there, when that time, COVID was new for everyone and no one knew what was it actually. So at that time, initially, if you remember, the COVID hospital and COVID ward, and then both the routine activities were initially, were done in the same hospital like TRIHMS. And then, but then at that time there was more risk of cross infection.
Yes.
Like the hospital is there in the vicinity of the hospital. in the vicinity and nearby that same normal wards are there, normal routine activities are going on. So there was a more risk of cross infection. But fortunately, after we all gave the feedback about this thing, then the government decided to separate the COVID hospital there at DCH Chimpu. So that way. Then one more thing here is you see the difficulties is when the patients now also you never know which patient is having. Maybe the patient is not is a case of some respiratory infection, maybe some other disease, maybe a cancer patient. But then you never know who is a carrier. So these are the difficulties because these patients, they walk into our OPD, they attend the casualties. In the casualty, and some maybe in an emergency, some road traffic accident case might be there. So what we do here is for the safety, we make we have made it that at least the rapid antigen testing should be it is made mandatory. And then so that at least we unknowingly we don't admit a COVID patient to make it riskier for all of us. So in this thing sometimes with this I would like to request our good patients also because many times what happens is when our staffs, they ask for a rapid test. Yes. They react. They say I am coming from an interior place, or I who says I'm I'm having COVID, or some say are you all trying to make money out of this? So these are the things which we face, the patients when they say when they question our integrity, they say when we say you have to go for a testing, a rapid test, and sometimes it so happens that the patient is the typical the symptoms are typically of COVID. So then that time when we go for a rapid test, sometimes it comes out negative. So then we ask them to undergo one more test for RT-PCR just for confirmation. And you see, this is confirmatory RT-PCR is just for the safety of we the health workers and also the other patients who are admitted already. So this we have to really take care of. So at that point of time, certain patients they get unruly. Also, they say why are you unnecessarily making us spend money or whatsoever? It's not about money only. It's about why are you making me getting tested again and again. So this is one thing I would like to taking this opportunity. I would like to request all public, to not to understand like why we are doing so. And
so regarding, is there any measures taken by the government for your safety?
yeah, we in in our in the DCH, it's totally like they are in PPE. There's in fact like working in the COVID hospital, the COVID ward is much more actually. You are more lesser at risk of getting infected. And then now like working here in the normal wards, normal OPDs, like it is you're actually you are more at the risk of getting infected because you never know. Because there we see like you see as our president sir he said like we maintain COVID appropriate behavior like N95 mask, then proper sanitation like after seeing the patients and that way. And so these are the things like because like the whole 12 hours one cannot be in a PPE. You know how difficult it is to be inside a PPE the whole day. So that's why like now as per the new SOP we have to just maintain with with COVID appropriate behaviors like social distancing or whatever like.
Okay. So, Dr. Taying, so how long this second wave will continue? Or there is again, there are rumors that third and fourth wave again?
As per mathematical formulas and all those things, we can't definitely say how long this second wave will continue to, but we should expect this wave to continue till the second week of June. After that, I think a little bit of dropping will be there.
Okay.
The curve will trend down. Afterwards, again, we should expect a third wave. Because in every pandemic, there are 2-3 waves that's happening. So in that, with that pretext, we should be ready for the third wave also.
Okay.
Because we should have been ready for the second wave by January 2021. But because of so many super spreader events, we are having a lots of cases in this second.
Okay. Okay, sir. So before we take questions from the viewers, this is an additional question to Dr. Lobsang regarding an unfortunate incident that took place at Hormin Hospital. So this is also my question. Usually people allege doctors for negligence. और कभी कभार ऐसे हो जाता है कि भावुक होके you sometimes blame the doctor for the death of your near ones. So how do we overcome such situations? Because आप लोग जैसे डॉक्टर जैसे सजेस्ट करते हैं हम वैसे ही फॉलो करते हैं. Like I also lost my father while treating the cancer. तो लेकिन suddenly गुजर गया, then किसको बोलूं क्या बोलूं? So how to control such situation? What do you want to say?
See, like as professionals, we are dealing with human lives. So human life is very dynamic. So we don't know like next moment what that patient would be. So it's a very dicey situation. So sometimes out of no one's fault also some patient expires, or maybe there may be some error of judgment on the part of medical profession that we don't deny. But then in any unfortunate incident, it's obvious that there will be emotional outburst, and also a human response is there, wherein it would be more agitative sort of response. So that is obvious. But then I think we as civilized society should also know that taking law in our own hands and trying to assault a doctor or even vandalizing hospital serves no one's purpose. So if at all, if the patient party, if they feel that there has been some negligence or error of judgment, whatever, so they can approach the legal way that is open for everyone. So if they want if they feel they will get justice through that. But then everybody coming together and trying to assault and trying to vandalize, I think this is a very bad indicator of a good society. I think we should avoid this, and as a society we should also introspect, because ultimately it is a society that would be at loss, supposing if doctors, if they cease to work. So ultimately, patients would only suffer. So that also has to be kept in mind. And we should provide a conducive atmosphere, a safe atmosphere where doctors can work without fear and duress, without any pressure. They can work. And if we want that, we should do good in healthcare aspect. We want that more and more hospitals, state-of-the-art hospitals, should come up in our state. So if such a situation of fear prevail, then I think many won't come forward to establish, or many won't be sending their children to become a doctor. So I think this has to be taken in a holistic way. I think proper law is there which will take its own course. So I appeal to the society through your channel again that let the doctors do their job. If at all, if there has been some error of judgment or any negligence, it is the law to take its action or its course. So, but then please don't take law in your hand and trying to assault doctors and trying to vandalize hospitals.
Okay, thank you. So now we will take some questions from the viewers from the comment section. You know, there is a question from Nana Pegu. When will vaccination for people below 45 start? Is it supposed to start from May 1st, 18 to 45? So any one of you can answer this.
So actually it was supposed to get started by this month, but then because of unavailability of the vaccine, so the state government couldn't start. Already, I think government has already paid to the Serum India, and also they have placed order to Bharat Biotech for Covaxin. Okay. But we are yet to, I think, get any answers from them. I think for 4 lakh doses already payment has been done to Serum India. So let's see, like because there is a pan-India shortage of vaccines. So as and when we get vaccines, definitely above 18 population will definitely get vaccine.
Okay. So Dr. M. Pertin, there is a question from Kada Tabu. Is oxygen available in all the COVID-19 dedicated hospitals of Arunachal? Dr. Pertin?
Yeah. Okay, we have two DCH, like one is in Pasigat and one is in Chimpu. So in both the hospitals, like we have provision.
Okay, so there is additional one more question. Just a second. This is a little bit of irrelevant question, but does night curfew and lockdown helps in containing COVID virus? Dr. Taying, Dr. Taying.
Okay, this is regarding night curfew and lockdown.
Yes. The people are asking about, does night curfew helps in containing COVID?
Okay, let us, in a broad perspective, let us think about it. Cut the chain of transmission of this virus.
Okay.
Okay. Because it is the people mingling among people that leads to the spread of the virus. So this lockdown has been put forward to cut the chain of transmission so that the virus stays where it is. It doesn't go further to the next neighbor.
Okay.
So this is the idea of the lockdown, so that the virus is stopped at that particular place, so that it doesn't lead ahead to the your nearest neighbor. So this is the logic behind the lockdown. And in this time, because of this lockdown, certain facilitations can be done in the COVID care centers or in the COVID hospitals. So this is the time where two-pronged approaches can be made.
Okay. Okay, there is a question from Mr. Jimmy Kamdartok. Sir, I'm suffering from chronic disease, although I'm not yet 45 years of age. Can I get vaccinated for virus from the vaccination center without any hassles or problem?
If you are not contraindicated for the vaccine, you should certainly go for vaccination.
Okay. Let me go for... There is a question from Hento Koyu. Can a person be virus carrier though he or she may be negative? Dr. M. Pertin?
Yeah, of course. Because you see, when he said like when someone is negative,
Yeah.
You see, these testing modalities, like this, you have to see about the sensitivity, like of the test.
Mm-hmm.
So now you must have seen like this rapid antigen kit is around like 60-70%, like maybe the sensitivity. So
Okay.
the rest of the remaining that actually they are is actually it's a false negative, like maybe. So if the patient if the patient is like in his report, if it is negative also, if he is carrying the virus, yes, of course he can be a carrier.
Okay. So Dr.
Even
Lobsang, Dr. Lobsang, there is a question from Choki Dorji. Can I take the vaccine after recovering from COVID-19?
Yes.
If so, there is a timeline when I should take this. Yeah.
So definitely, because
Mm-hmm.
people have seen that even if you are COVID positive, so they say that you shouldn't be taking vaccine.
Mm-hmm.
So after say after you get the infection, so you have good antibodies in your body. So usually they say you can give it a gap of 1 month or so. Then after that you can take the vaccine, because at that time now the situation is such that there's already shortage of vaccine. So if you have been recently recovered from COVID, so you have enough antibodies to guard you from the subsequent infection.
Yes.
So you can be rest assured for at least 2-3 months that you won't be getting infection. So at least as a sign of humanity, you can let others get the vaccine.
So Dr. Taying, there is one more question from Mr. Tadar Tasung. My wife was positive since 4th May of this month, and she is in home quarantine now. Her health is normal, and how many days to go for stay in quarantine? And when and how we will second test for confirmation? I hope you get the question.
This question is for
you, sir.
for me.
Yeah.
Okay. She has been detected positive on 4th of May.
Yes, now she's in home quarantine.
Now she is in home quarantine.
Mm-hmm.
Ideally, this virus has an incubation period of 7 to 11 days.
Okay.
So she has to be in quarantine for the fixed duration, say 10 days.
Mm-hmm.
Okay? So after that, she can be for another 7 days. That means on the 4th, and today is 10th.
Okay.
This makes her 7th day. And if she is symptom free, she can go for a RET or RT-PCR tomorrow or the day after. That is the 8th day after. On the 10th, she has to go on the 10th day of her being detected positive.
Okay.
So on 10th day, if she is negative, then she has to further isolate herself for another 1 week.
Okay. So
I just
Dr. Pertin.
Because as per the new SOP, so we when we say for 10 days, so after 10 mandatory 10 days, so after 10 days, as per the new SOP, if there has been no symptoms for the past 3 days, then you don't have to go for testing also. Okay. That is SOP. Or else, fine, as Dr. Kumar said, you can go for an definitely if you want to, then you can go for a confirmatory RAT.
So last two more questions. There is a question from Byabang Nehru Dui. How can we improve oxygen level while staying in home? I don't know if this question is relevant.
This is for?
Any one of you can answer.
Okay, regarding improvement of oxygen saturation, staying at home. The best thing is what we do, we have to do the breathing exercises.
Okay.
Okay, breathing exercises and living in a tidy environment.
Yes.
That's the only thing we can do to improve we cannot improve the oxygenation in a normal condition. When you are a little bit having symptoms, then you can do all these breathing exercises, living in a tidy environment, well-ventilated room. All these things help in improving the oxygenation in your body.
Okay. So this is the last question I will be taking from Mr. Jimmy Kamdatok. My question is like, how much remdesivir medicine is beneficial in fighting the corona-inflicted patients?
Okay, this I will answer.
Okay.
I have been with this corona since March 2020, and I am still in the front line against COVID stationed at this year Chimpu. My experiences till date was that this remdesivir is very beneficial in the fight against COVID. So here we have to give 6 shots of remdesivir injection. On the first day, we give 200 mg means 2 vials in a 100 ml NS. That is to be run over 1 hour, followed by 100 mg in 100 ml NS for the next 4 days. So my experience and the experience there in the designated COVID hospital Chimpu says that remdesivir really works. When it is given in the right time.
The right moment. Okay. So this is my question from my side. Even I had my first dose of vaccine I think a week's back. So why there is a side effect? You know, why do we feel like we are suffering from fever? Any one of you?
Yeah.
So see when any thing is infused in your body, so it is a foreign body, so your immune system will react. So anything goes inside your body, our immune system reacts. So that shows that your immune system is healthy. So when your immune system reacts, so you can have, say, fever, myalgia, body ache, all those sorts of things you will have. So, but these are all normal symptoms. So that is obvious, but those are not very severe symptoms. So only I think in very rare cases you have severe reactions. But then I think in almost all individuals who have taken vaccines, majority will have bit of fever, bit of body ache, and like say tiredness. These things, headache. These things are obvious. So because of your immune system that is reacting against the foreign body, that is put in form of the vaccine.
Dr. Pertin, want to add something?
No, yeah, the same thing. Like rather you should be happy, like when you have some symptoms like myalgia, a bit of like a fever, because that means your immune system is responding well. And Dr. Lobsang has said about the reactions. You see, these are all, we call them as AEFI, like adverse effects following immunization. But that is that's why we keep the patients like under observation for around 30 minutes, so that those are maybe urticaria or reactions. No, so that is quite different. But then I would say having all those symptoms, your immune response is quite good enough.
Okay. So, Dr. Taying, so before we conclude this session, I will be taking a takeaway message from each one of you, because as of yesterday, the total cases recorded so far is 20,370, recovered 18,315, active is 1955, and that recorded till yesterday was 64. So, are you expecting more cases, or what kind of suggestion you want to give to our viewers? Briefly.
Hello.
Yes, continue.
Unless or until we follow the COVID appropriate behaviors and we follow the lockdown and the night curfews in letter and spirit, we are going to see higher number of cases in the weeks to come.
Okay. So
let us not be complacent that if the graph comes down, so we are free from COVID. No, let's not be complacent. Let's be ready to face the third wave, which imminently will happen.
Okay. Thank you, sir. So, Dr. Pertin?
Yeah, from my side, I would like every individual, every citizen of of Arunachal Pradesh to be wise enough, because and then spread awareness. Now, be informed, don't be ill-informed, and then spread good messages, and then whatever you see in the social media, all those things, so you don't have to really have a knee-jerk reaction to that. You have to have take care of yourself first, And one more thing is especially to you and all the media people.
Okay.
Like, because since you are the fourth pillar of fourth pillar, so my earnest request to you is like not only Arunachali media, I mean all over, like I say please spread the only the positive thing on them, some certain positive things also. You see, most of the media people in the news also, if you see, they will it will be like a headline like this many that oxygen is not there, this is not there, but then many they are not showing those who have recovered. And then from such very dire situations, like people have come out of those. So those.
Sorry, mute ho gaya. Anyways, now let me move to Dr. Lobsang. So final concluding takeaway message from your side, sir.
So I'd like to say that these are unprecedented times. We are in a zone of, say, uncertainty. So I think each and every individual has to know its responsibility and rights, responsibility more, because each and everyone needs to contribute to reducing the spread of this virus. And I think society as a whole has to look into itself, following the COVID appropriate behavior. I think vaccination, also preventing overcrowding, going into closed spaces, so which are, I think, detrimental for the spread of this virus. So state government is doing the maximum that is possible, but then I think it is the responsibility of the society, NGOs, or civil bodies, and as an individual also to come forward and give their bit towards containing this virus.
Okay. So thank you so much, all three of you. I hope to see you all again very soon again. So thank you so much.
Thank you so much. Thank you.